AFMC is really known.
That this video will provide ideas
And also make sure
between the office hours.
Welcome to this edition of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. I have with me board-certified psychiatrist, Dr. Rhonda Mattox. Thank you so much for joining us.
Thank you for inviting me.
And you are the president of the Arkansas Medical, Dental, and Pharmaceutical Association.
Yes.
Busy lady.
Yes.
So let's start with this. There's a lot of stigmas to see a psychiatrist.
Yes.
Tell me why.
I think a part of it is that we have been reared to do things on our own. We really value strength and personal independence. And so the thought of needing someone else, of sharing your intimate concerns with someone else feels a little bit uncomfortable or a whole lot uncomfortable.
And so most people are referred to a psychiatrist, a therapist from their PCP.
Yes. Many times people are referred by their PCP, but other times you have family members who realize there is something wrong. You are not who you used to be, and I'm concerned about you. And so many times when people hit rock bottom, they will, their loved ones will give them the gentle, not so gentle nudge.
And so what should a PCP be doing if they identify that, or what should they be looking for if they see that a patient needs to see a therapist?
I love it when primary care docs do these screenings to where they're screening for if you are in fact depressed, or if you're suicidal, or if you're anxious, or perhaps even using substances of abuse. So ideally, they're screening frequently for that so they can catch it. But other times people come in and they tell them, or their relatives come in and tell them, this is going on, I'm concerned. And then they go sometimes kicking and screaming. But others, as you've seen during the pandemic, it's been a little bit more okay to be not okay. And so other people are now, because others have come out and shared publicly their struggles and their good results with seeing someone, they're more likely and more open to it now than they have been at any other season that I'm aware of.
What do screenings look like?
So when I think of screenings, particularly in a primary care doctor's office, I think of the PHQ-9, and I can't even think of what PHQ-9 stands for now, but it is a screener that assesses what's your energy like? How are you concentrating? Have you been having thoughts of hurting yourself? How are you, what's your appetite like? Are you enjoying things that you used to enjoy? And it is getting an idea of how healthy you feel and how impaired you are. Are you able to do things you once enjoyed doing? And that's one. The other is the GAD-7, General Anxiety Disorder Questionnaire, and it's 7 questions. And that is asking you more about, are you nervous frequently? Are you restless? Do you fear the worst? Those types of questions.
So how would you recommend a PCP get more comfortable evaluating and treating people with behavioral health, mental health issues?
Oh, yes. I would say making sure that they do continuing medical education courses where they learn specifically about mental health. The other piece is reading more and prioritizing it. And we have some courses that are especially for the primary care doctor. I work with an organization called Reach Institute, and we train primary care docs in how to assess for bipolar disorder and treat it, how to assess for depression and treat it, how to assess for pain conditions and substance abuse and ADHD and all those things, even psychosis, and get more comfortable doing it.
Interesting. So is the Reach Institute something that's in Arkansas, or is it a nationwide organization?
It is a national organization, or it's available nationally, because some of our trainings are virtual, courtesy a perk, if you will, of the pandemic. Now we have more virtual trainings. We have one coming up, I think, in August in Florida. And I am, again, one of the trainers there. But we have a lot of primary care docs who are trainers as well as psychiatrists. And with that, after you go to that 3-day training, for the next 6 months, every couple of weeks, you have the option to bring a very trying patient case there and present it to a group of psychiatrists and therapists and get feedback on how to engage that. So it's pretty cool.
Very, very hands-on, it sounds like.
Absolutely.
So let's talk about grief and bereavement. So that's a part of that a healthcare provider would use or work with their patient. How do they get better at treating that sort of thing?
I'll tell you how I got better. I got better by actually going through it and realizing that I was horrible at it. First of all of us suck at death, okay? So we completely suck at it. And many times people are uncomfortable, particularly if they've never experienced it intimately, and so they tend to run away. If you are not comfortable working with people who are bereaving and grieving, it's a great thing to have your nurse get trained or a therapist get trained, because we understand that primary care doctors, they have a whole lot of competing demands. They're supposed to handle the diabetes and and hypertension and different things. And so realizing that may not be where you can spend the bulk of your time, but if you could recognize it and then put their hand in the hand of someone who is comfortable treating that and who has the time. The average primary care doc's appointment time may be 7 to 15 minutes. My time is 30 minutes to an hour. So I have more time to be nurturing and encouraging.
And focusing on that one thing
Absolutely.
versus everything else that a PCP
Absolutely.
would be focusing on. That makes sense. So what can healthcare providers do to help patients with anxiety?
That's a great question. I think the first thing is I'll always go back to continuing medical education, because we have to do CMEs and prioritizing getting some training in that area. And if you know that you're not a person who you really want that, then I'm going to echo again, make sure that you have staff who are empaths, who are empathetic, who can connect and then help out, because patients with anxiety can be more challenging because they are it sometimes takes them 3 or 4 times before they are even going to consider doing something about that. And while they want better, but they're afraid to let go of what they have, because what if it gets worse? And so you really have to build relationships with people with anxiety so they start to trust you. And one of my sayings is, listen, this is an amazing medicine, but it only works if you actually take it. It doesn't work because I prescribe it. It doesn't work because you go to the pharmacy and pick it up. And it doesn't work because you look lovingly at it on your nightstand. It only works if you start to take it, and take it consistently. And if you have concerns about it, then follow up and schedule a more rapid appointment with your doctor so you can express their concerns. But whatever you do, don't Dr. Google it and then begin to practice medicine with your unlicensed self.
Or stop it when you feel better.
Absolutely.
You have to continue to take it.
Absolutely.
So tell me about caretaker burnout. That seems to be a bit of a hot topic right now too.
Absolutely. So caretaker burnout is when you have been chronically at it, helping others, and you've been pouring and pouring and pouring into others at the expense of yourself. And you have not been taken care of and taking those little mini vacations. And many times people think burnout, go on a vacation. But if you can build into your day a little bit longer time to rest, a little bit longer time to enjoy your coffee, or to enjoy your children, or to enjoy your neighbors, perhaps gardening or what have you, it can really help. But burnout, particularly caretaker burnout, comes when you love someone and you're really helping them, but you're doing it at the expense of yourself. And after you've done that for a certain duration of time, and there's no particular duration, but after you've done that for a certain duration of time, you find yourself chronically just kind of spent, chronically fatigued, almost like looking at the world through it's a half empty kind of world. What does it matter? Nothing matters. And so you find your ability to be empathetic kind of drained, and it's almost like, what does it matter anyway?
I relate in so many ways as being a very busy mom.
Yes.
And seeing it, taking care of everyone else in your family and having to stop and have grace with yourself.
Absolutely. And think about Goldilocks and the 3 bears. Do you remember that the mom's porridge was cold?
Right. I relate.
The mom, there are somebody who was just right, but it wasn't mom's, And if you have that kind of fine balance as a mom to where you're doing this and you're doing that, and then your in-law gets ill, or your husband has a car accident, or somebody gets fired at work and now you have to take over, then that very fine, delicate balance that you've been walking is in upheaval, and then you have to do extra. And as a mom, in the midst of the pandemic, I remember that Thursday text at 2:20 p.m. from the school department telling me to come pick up my child while I was in the middle of my workday. And all of a sudden, in the blink of an eye, I became a virtual educator through the school system. While I might add that I had a whole array of patients scheduled, that I had plans, and I had other things enacted. And now all of a sudden, I'm supposed to be in the room with my daughter while she's schooling. And so the pandemic was murder on us. And many of us self-soothed with COVID calories, and we packed on pandemic pounds and did a little extra.
Yes. So as far as the pandemic and burnout,
Yes.
You mentioned early on that it did seem to raise a lot of concerns, though, about mental health. Has telehealth changed a lot for you?
Absolutely.
And therapy that way?
Yes. So I got involved in the research of telehealth and the outcomes in depression around 2005 or so. We actually have publications, I think, in 2011, 2012, talking about the safety of doing telehealth in patients who are depressed in remote areas. So I had been doing telehealth all along the way. And in fact, I was doing telehealth almost completely before the pandemic. But what happened as a perk of the pandemic is that insurance companies now prioritized reimbursing at more equivalent rates. And people prioritize getting the technology, the bandwidth, the broadband availability so that we could do it more fully. And so one of the perks has been now that in our mostly rural state, that now we have access to expertise from cardiology to different things in our very remote parts of the state. And so that is a perk of the pandemic for sure. But one of the other pieces is that access to telehealth in places like Pocahontas, where I worked, Clarendon, where I worked, Walnut Ridge, that became more accessible to them, and it was reimbursed. And that made all the difference in the world. And so I'm so thrilled now, because there was a time when people had to take whoever would go to those areas. And sometimes the people who were willing to go were not the best qualified. And many times there were communication barriers. Now this has opened up a wave to where you can truly get people who are experts in their craft in those remote areas. And so I count it a win. I feel a little guilty saying that, but it was one of the unanticipated wins that we gained from the pandemic.
Oh, I think that's a win, absolutely. To have more access to better healthcare, therapy,
Yes.
all around,
Yes,
and to be able to
absolutely.
afford it for sure for rural Arkansans. It's so
Yes.
important. So, Dr. Mattox, tell me about what you're going to be talking about at the ACES conference. So that's coming up August 4th at Pulaski Tech.
Yes. I'm excited. One of the things that I'm going to be talking about, of course, is the elephant in the room, burnout. And we're going to be talking about really how to get from that whole desire of I'm perfect, I have all of my stuff together, and dealing with the black sheep in the family who aren't perfect, who don't belong. And so the theme of the conference is around the power of belonging. And we are going to talk about some of the lessons that you learn when you're not in the in crowd, when you're actually on the outside looking in, and really how to embrace your I'm an other, and people don't get what I have to offer, and some of the benefits of that. As a person who graduated only Black in my class from Grace Christian Academy, I was the other. But there were some things that I was able to do and some lessons that I learned that I wouldn't have gained if I'd been the popular kid. and it really worked for me. It worked out in the end. But as a person who was rejected and overlooked, I'm very sensitive and in tune to people who are considered the black sheep of the family. And I think it really helps me in my role as a psychiatrist.
Well, I have no doubt that your session will be great. I've learned so much today, and I appreciate you for coming and being a part, sharing your knowledge and information with our audience. Thank you so much.
It was my pleasure. Thank you.
Well, that's it for this edition of AFMC TV. Thanks for watching and have a great day.